everyone, and thank you for joining us for today's webinar, The Importance of Advocacy in Medical Fitness. I'm Marianne Murphy, Vice President here at the Medical Fitness Association. I'd like to take a brief moment to introduce today's presenter. Michael Stack is the founder and CEO of Applied Fitness Solutions and the Michigan Moves Coalition. He's a faculty lecturer for the University of Michigan School of Kinesiology. He's also the creator and host of the Wellness Paradox podcast, produced in conjunction with the University of Michigan. Michael is an exercise physiologist by training and a health entrepreneur, health educator, and fitness industry advocate by trade. He is dedicated to the policy and system changes to ensure fitness professionals become an essential part of the healthcare delivery. Now, if you have any questions as we move through today's webinar, please put them in the chat section or the Q&A section of your toolbar, and all questions will be answered at the end in the order they were received. Okay, Mike, take it away.
Thanks, Marianne. As Marianne and I were talking before we started, this is the third time that I have given this particular talk to MFA stakeholders. And, as Marianne said, she feels that this is an important enough conversation. The MFA feels this is an important enough conversation to have many times, so everyone has the opportunity to hear it. So I'm very grateful to talk about something that I'm very, very passionate about. So there will definitely be some time for questions at the end. I'll also preface this by saying there's a lot of information in this presentation. I just encourage you to sit back, listen, understand high-level themes and concepts, and then you're going to get a follow-up that's going to have the slide deck where you can really dive in a little bit more actionably. But as Marianne was introducing me, she talked about my work in the policy and systems change space, and that's very macro-level work. Many of you listening probably work a little bit more on the micro level. You're in a facility, maybe you're managing a facility, maybe you're working with individual clients and patients, and that's easier work to understand because it's direct, one-on-one patient care with an individual. Policy and systems change work on the macro level is complex, and it's very much interrelated to a number of different areas. So don't get too worried about the details as we talk about this. Just kind of understand overarching themes and then allow yourself some time to become a little bit more familiar with the details. Now, for starters, fair warning that this is a conversation that is going to occur around politics. I mean, ultimately, advocacy and policy and systems change does involve politics to some degree. And this is a tenuous topic at all times, probably no more tenuous than in an election year when we're 3 months out from an election in the current political climate that exists in our country. And so I firmly understand if your response to a conversation around politics is just to go bang your head into a brick wall, because I think that's where I was 4 or 5 years ago before the pandemic. But we all remember this very, very well. This was a punch to the gut initially. Like, we were closed during a public health crisis where we were an industry that could help improve public health. And I was one of the people initially that said, you know what? We don't know what our environments are like. Could our environments possibly be super spreader environments? And so maybe, caution is the best path. But as time went on, we started to realize that, our environments, weren't those super spreader environments that people thought they would be. And in fact, they were fairly safe by way of comparison. Yet our industry was still lumped in with restaurants, bars, entertainment venues. This was a painful, painful time for our industry. And I will tell you, when we were closed down here in the state of Michigan, I'm from Michigan, we were closed for one of the longer periods of time in the country. We didn't get back up to full occupancy and full capacity in our facilities until well into 2023. And that would have been really bad. Well into 2021. And one thing that I didn't know at the beginning of the pandemic was how we were going to get out of this and what were the things to do and how could we advocate for our industry. And myself and a handful of fitness industry leaders in Michigan decided that we were going to band together to do advocacy. And we formed the Michigan Fitness Association, which unfortunately has the same acronym as the Medical Fitness Association. So you can imagine the confusion that often happens when I talk about the MFA. I have to qualify. So in this presentation, we'll use Michigan Fitness Association instead of MFA. But we were all closed and we didn't know what to do. And at that point, we certainly didn't know what the path was to reopening and to getting back to a thriving industry. So, that's May of 2020, we formed this Michigan Fitness Association, and where I really began to cut my teeth as an industry advocate. I wasn't sure if I could even make a difference, but we were closed, we were at home, and I had to do something because I just wasn't going to want to sit around. And these two pictures are very telling pictures. The picture on the left side of the screen is myself and two of my colleagues. The woman in the middle, her name is Alyssa. She owns a small fitness business in Rochester, Michigan. The gentleman on the end is Brian Reef. He's the CEO of Epic Fitness Group that runs most of the Planet Fitnesses in the state. So you can see we ran the gambit as an association in terms of representation. And this was in 2021. You see the people in the background with the masks on. And we are actually testifying before the House Appropriations Committee for $53 million. And I got to tell you, when I was driving out to our state capitol that morning, when I was driving out to Lansing, I thought, man, there's no more impactful thing that I could be doing for our industry right now than doing what I'm doing. I mean, that is a massive game-changing sum of money. Now, we didn't get $53 million, but we did get $8.5 million for our industry here in Michigan. And in fact, to our knowledge as a trade association, it was the first time a governmental entity, federal or state, gave money to a fitness industry trade association for the express purpose of improving the health and well-being of their population. So this was a really transformative event. And we didn't necessarily know how to do this when we started, but we figured it out and we became strong advocates and we learned. The picture on the right is myself and Alyssa again at the Michigan State Capitol this past May. And we were actually up in Lansing doing advocacy work, not to make something happen, but to prevent something bad from happening. A lot of advocacy is defensive advocacy, and we'll talk about that a little bit later in the presentation, but we were actually in Lansing to stop something that would have been very onerous from happening. So we were having conversations with lawmakers, particularly one lawmaker in particular, who was looking to enact legislation on cancellation of subscription and notification of auto billing. And basically what this particular legislative representative was suggesting is that he was going to introduce a bill, which, if it became law, would become the law in the state of Michigan, that would require all our facilities in the state, all of our fitness centers, medical fitness, regular fitness centers, everything in between, to notify each member every single month by more than just an email, by like a text message or a phone call, that we were going to bill you. So just imagine how onerous that would be on all of our businesses to have to notify of auto bill every single month. It becomes not only logistically prohibitive, that something like that could literally bankrupt our businesses. And we were up there to have a conversation with that lawmaker to educate him. It turns out that really what he was trying to do was trying to prevent people from paying on their Candy Crush subscription or their music service subscription that they didn't intend to have, to pay for that over and over and over again without them knowing. He wasn't intending to lump our industry into that, but it became an unintended consequence of the way the legislation was written. So we went up there to provide him education. And it turns out that after he listened to us and he understood a membership model is different than a subscription model, that we needed different requirements. So we were actually stopping something bad from happening at that point. And I have to tell you, advocacy, when done right, more often than not, stops bad or onerous things from happening as much as it makes good things happen. You just don't always hear about stopping the bad things because, how do you prove a negative, or how do you quantify the impact of something that didn't happen? But that was a really important day for us to have that type of representation. And I think both of these situations, as well as COVID, remind us of this quote: if you don't have a seat at the table, you're on the menu. Bottom line. And that was what was true of our industry in COVID. I fear that as COVID has receded, I feel like a lot of us have forgotten the importance of a seat at the table. But there are things that are happening at the local, state, and federal level that affect policies and systems in which our businesses operate in that environment. And we always need to have a seat at the table, because if not, we will continually end up on the menu, and we cannot forget that. An interesting story that I'll share from the pandemic was a conversation with a gentleman that I had developed a really good relationship with throughout the early part of the pandemic. He ran MyOSHA, so the Michigan OSHA department. And he said to me that in February and March of 2020, he looked for somebody to call in our industry to talk about how our industry could safely stay open during the pandemic. And he couldn't find anybody to call. And the reality is, at that point, there was nobody to call. There was no representative organization of our industry. And because we did not have that seat at the table at that time, we ended up getting shut down. Now, would it have been demonstratively different if we had the seat at the table at the time? I don't know. We probably still would have been shut down, but I bet we would have been having very different conversations and got reopened much sooner. And I don't think our state was unique to that. I think all states that were out there did not have the proper seat at the table, and we certainly didn't have it at the federal level. So with that said, I get it. I get it. I get it. Politics involve politicians, and politicians can make our skin crawl sometimes, and sometimes we just don't want to be involved. But the good news is this, and I can tell you this from talking to people along the ideological spectrum, people who are very much aligned with my ideology to people who are on the polar opposite of my ideology. In fact, the woman that took that picture of us testifying before the House Appropriations Committee, I would say to you that she is ideologically opposite of me. We don't see eye to eye on a lot of things, but she believes strongly in what our industry did, and we were able to come together and work together in a way that produced positive change, largely because every person I have ever met, pretty much anywhere, but even in politics, universally agrees that going for a walk and being physically active and moving is a good thing to do. All that to say is that physical activity, movement, and exercise is one of the most, I won't even call it a bipartisan issue, I'll call it a nonpartisan issue. Like, this is not a partisan argument that people are having. No one's saying that you shouldn't exercise, that exercise is bad for you, or you got to do it this way in politics. They just want you to move. Everyone universally agrees on that premise. And it doesn't matter who you talk to, they're open to that. So we're not coming into this with a controversial conversation, fortunately, even in the nutrition space. I have a colleague that I know that's in the public health service, which is part of the organization that publishes guidelines like the physical activity guidelines and the nutrition guidelines. And even they'll tell you that even in the nutrition space, there's a decent amount of partisanship. There's lobbies and there's big money interests in food, just because it's such a driving force in our economy. We don't have that kind of partisanship and tribalism that exists in our space. Like, we all just agree that moving is a good thing. So this may be involving politics, but at least it's politics that is not political as I think you can get. But I also concede that, like, politics is not a exciting thing for many people to get involved in. I think this has always been true. I think this has been more true in the past decade and a half as our countries became more polarized. So I'm going to invite all of you to take a perspective shift here. And I'm going to ask you to think about this not as politics, but more as civic engagement. And let's understand civic engagement. If you break it down on its most basic level, civic engagement is working to make a difference in the quality of life of your community. That's what civic engagement is. And I would argue that all of us do that every single day in our jobs, like especially in the medical fitness space. Like we are making a profound difference in the quality of life in our community. All civic engagement does is take it from the micro level to the slightly less micro level. We're not talking about the macro level where we're doing advocacy on Capitol Hill in DC, but just maybe to the city level or the county level, or maybe if you're so inclined, the state level. But as we'll talk about in this presentation, all politics, all health ultimately is local at the end of the day. And so by being civically engaged locally, you can make big differences in your community. And when we think of civic engagement, I call it the 3 T's and the V: time, talent, treasure, and or all 3, and then voting. Voting. This is an election year, so I feel like I could get on my soapbox, but I won't. Voting is so critically important, and certainly voting at the national level and the state level is important, but it's those local level races that dictate a lot of what happens in our community. So I won't belabor the point too much. Be informed and be a voter. There's a great book that I really recommend, particularly in these times where I feel like things are so polarized and people really want to withdraw from just in general being involved in small d democracy in our country. And the book is Democracy in Retrograde. And the author of the book does such an amazing job of making civic engagement approachable for people. And particularly for those of us that are anxious around the political climate in our country, I think this book is a great way to calm anxiety to a certain degree, because it allows you to start to learn some things to approach civic engagement a little bit more proactively and a little bit more of a comfortable fashion. So highly recommend that book. It is a tremendous read. So let's talk about the 3 topics we're going to cover. We're going to understand our rights. We're going to understand the type of advocacy, and we're going to talk about action steps to becoming an industry advocate. And man, that last one, when it was May of 2020 and myself and my colleagues at the Michigan Fitness Association are sitting there trying to figure out what the heck should we be doing, I wish somebody could have said, Mike and friends, here's the game plan, here's the roadmap. We didn't have that, and that's what really inspired me to put together this presentation and provide this education. Is I don't want other people to be in the situation that we were in, because there are clearly defined action steps. There is a framework, and it can be followed successfully. We just need to know what it is. So let's start with understanding our rights. In the interest of not taking you back to your high school civics class, if you even remember it, the First Amendment to the Constitution is a critical component of the fabric of our small d democracy. And in this First Amendment, we often remember freedom of religion, freedom of speech, freedom of the press, and freedom of assembly. We often remember that, and for good reason. Those are founding principles of our country. But sometimes we forget about this petition the government for redress of grievances, which is a fancy way of saying, hey, to talk to people in power about the things that aren't working for us, to speak truth to power and let our voices be heard. It's a civic duty for us to do that. It's also a privilege for us to do that. There are countries around this planet that you could be killed for doing that kind of thing. And not only can we do it here, but it's codified into our Constitution. And it's also an exercise, it turns out. So I can't help but think that maybe the framers, in their infinite wisdom, when they were writing, this First Amendment, they might have been thinking about us. I digress. So what grievances could we have? Well, we could have closure during a public health crisis. We could have zoning requirements. I know that affects a lot of your businesses. It's a local level issue. Taxation of club memberships. The industry around the country has fought this successfully over the years, but it keeps cropping back up. How does the government, get more money from its tax base? Well, it looks at services to tax, and sometimes we're talked about being lumped into that. Online membership cancellation, that's certainly a hot topic right now that's happening around the country. I mentioned the auto renewal requirement, and don't think for a second that just because we fought that successfully here in Michigan, it's not going to come up again here in Michigan. And also don't think for a second it's not potentially going to come up in your state, because stuff that happens in one state finds its way to happening in other states. Data privacy, this is becoming bigger and bigger issues. I'm sure those of you that are directly affiliated with the health system, I know this is something that all of you guys are thinking about. The locker room thing is a big challenge. Here in the state of Michigan, we are preparing our industry for a class action lawsuit around gender neutral locker rooms. This is a really, really challenging thing right now, and I know a lot of you are dealing with this. Planet Fitness here in Michigan has had some really challenging situations associated with this, to the point where they've had some protests and some bomb scares associated with things related to locker rooms and gender neutrality. And then lack of qualified healthcare professional status. We're going to talk about the professionalization effort that is underway in our industry a little bit later in the presentation, and how that potentially can lead to insurance reimbursement one day. And that is a form of very exciting offensive advocacy. So we talked about some defensive advocacy earlier, getting reopened during a public health crisis, preventing that onerous legislation around auto renewal requirements. But let's talk about something positive and how we can move the industry forward. So let's talk about advocacy. So what is advocacy? Well, advocacy is to publicly support or suggest an idea or develop something that is something we want to talk about to a large group of people. We're representing a person, a group of people, a cause. We're speaking or defending somebody in court, maybe. Hopefully we don't have to do that often. The point is what we do in our industry is advocacy all day long. People in the health and fitness industry, particularly people in the medical fitness industry, are some of the best advocates I have ever met. We are very passionate. We're very intense about it. And we talk to everybody we can about the great work we do. We already do advocacy. Most of the time, it's just to a patient, a client, maybe a health system executive, maybe a small group of people. What I've suggested in this presentation to become an advocate for the medical fitness industry is we just need to reorient that advocacy to the policymakers and to the systems and the structures that exist to create more favorable conditions and environments for our industry to operate in and be successful in. So with that said, we've talked about this before, and I want to just really put a fine point on it here. There are two forms of advocacy. There's defensive advocacy, which is preventing something bad from happening. So preventing legislation from being enacted that would have a negative or onerous effect on an industry. And then there's offensive advocacy. Offensive advocacy could be grants, and that's something that we fought for here in the state of Michigan. But this also is really where the professionalization effort that's currently underway in our industry to make highly qualified exercise professionals considered qualified healthcare professionals, that is really the tip of the spear in terms of offensive advocacy in our industry. And it can and should be, creative. Offensive advocacy is the ability to think outside of the box and go, how do we create a more favorable policy and systems environment to do what we do better and to impact more people on a broader level? So with that understanding of defensive and offensive advocacy, I'm going to talk quickly about the steps in legislation becoming law. And I feel like this is the adult version of the Schoolhouse Rock video that we all remember about the bill on Capitol Hill. So for those of you that are old enough to remember that, you get a chuckle. For those of you that are not, Google it at some point and watch it. You'll get a chuckle. But here's how legislation becomes law. A bill gets drafted. Somebody somewhere writes a piece of legislation and it's called a bill. And it's normally happening because someone brings an issue to a politician that says, hey, we should do something about this. So they draft some sort of a bill. And then it gets introduced into one of the chambers of Congress, the House or the Senate. And again, this is true at the state level. It's also true at the federal level. It goes to a committee to get reviewed and debated in the committee. And then it gets passed out of the committee. And then from there, it goes to the whole chamber for review and debate. And then if it gets successfully passed out of that whole chamber, it goes to the opposite chamber of Congress. So if it was in the Senate, it goes to the House. If it was the House, it goes to the Senate. And then after that, if it passes out of both chambers, then you have chief executive action. So the governor, the president signs it into law or vetoes it. If that chief executive vetoes it, then Congress can override the veto with a certain majority of the vote. So I tell you this, you can intervene at any of the stages in the process. The earlier you intervene, the more impactful you can be in fighting the legislation or bolstering the legislation for your purposes. So as an example, if you were on the ground floor of drafting the legislation, you have a lot of ability to control and shape what that law could look like. Now, sometimes that's possible, sometimes that's not. Go back to our example of notification of auto renewal here in Michigan. We got involved in step 3, which is the committee review and debate part of the process. And that was a critical place for us to get involved because we actually got the language to the legislation amended at that point, which was critically important before it got passed out of committee, which actually turns out it didn't. It's an election year and not a lot of stuff is happening right now. But just imagine if by the time we heard about that issue and started to talk about it was at the time that the chief executive, so in this case, the governor of Michigan, Governor Whitmer, was going to sign that into law. What was the likelihood that we would get an audience with Governor Whitmer at that point to be able to prevent that from becoming law? Probably pretty unlikely, but we could definitely get a meeting with a lawmaker who we met with and had a conversation around, this particular item. So all that to say, you can intervene in a lot of these steps. So you can assist in drafting and amending language. And I understand that sounds like it is very intimidating. Like the idea that you or your colleagues could actually assist in drafting legislation sounds like it's completely out of your league. But it turns out that you don't need to do the technical element. All lawmakers have some form of legislative counsel, the lawyers that put the legalese in. It's people like us that understand the technicalities of what's being talked about. We can put the general language in there, and then they can modify the language as they need to relative to whatever the prevailing statutes are. And at all steps in the process, you can inform and lobby at the committee level, at the whole chamber level, at the chief executive level, and you can even do it in the veto override process. The earlier you get involved, the better. Again, when it's about ready to become law, you're going to find a really, really hard time being able to stop the momentum at that point. Now, I'm not suggesting that everyone's going to go out today after watching this, look at all the bills that are going through their state house or state senate and go, okay, we're going to go after that one, because there are steps to becoming an industry advocate. And it doesn't necessarily start with you marching into your state capitol or marching onto Capitol Hill in Washington and talking to a lawmaker. So let's start with steps. Like, how do we start to dip our toe in the advocacy water? Sometimes you're throwing in head first, which is what we were during COVID. Fortunately, I don't think we're at a point of crisis right now as an industry. So you can decide how you want to approach becoming an industry advocate and what feels comfortable and doable for you right now. But what I will say is this: we all need to follow some of these steps if we're going to ensure that our industry thrives in the future economically, while at the same time dramatically improving population health. So step number 1 through 5 that we'll go through go from what I would consider to be kind of least intensive and probably least scary to most intensive and potentially most intimidating. The first one is be passionate. This is table stakes, right? To do advocacy, you have to be passionate. The good news is our industry has passion in spades. Like, none of us got into this industry because we wanted to make millions and millions and millions of dollars. I teach an introductory class at the School of Kinesiology at University of Michigan. And I asked my students in the first class to say, hey, who's interested in making millions and millions of dollars? And and invariably you get a couple kids that raise their hand. I say, you know what, the Ross Business School is right down the road. If you want to get up and walk down there, you can make millions of dollars. But in our industry, you're here to change lives and hopefully make a livable wage and a good income. But we're not doing this because we're looking to become millionaires and billionaires. We're doing this because we have passion that has made us very persistent in what we do. And we need professionals who are advocates in our industry, who are not just passionate, but they're educated and they're articulate. We need the best of us to be advocates. And I truly believe that medical fitness is the best of us. Like, we are the best representatives of our industry here that we have to offer. So step number 1 is be passionate. I believe all of you have that. Step number 2 is stay informed. You can't advocate for something, you can't make a difference in something if you don't know the issue exists. And what I find so often is most people are just uninformed. And it's not that they don't want to be informed, it's that they don't know where to go to be informed. Well, after this presentation, you're going to know where to go. So the responsibility is on you to ensure that you stay informed. So the first thing you need to do is be aware of legislation that's being considered at the local, state, and the federal level, particularly local and state level. So I'll give you an example. Here in Michigan, there is a push for paid sick leave that is making its way through the legislature. And here in Michigan, they have the trifecta. We have a Democratic governor, we have a Democratic House, we have a Democratic Senate. Much easier to get things done when you don't have divided government. Well, this paid sick time affects all businesses in the state. If you have more than one employee, this affects you. And although it's going back and forth in terms of the negotiations right now, it looks like there is going to be law that will state that all employers in the state of Michigan have to offer their employees paid sick time. Now, we offer our employees, paid sick time. I'm not sure if this legislation is going to come in require more, but I know there are a lot of businesses in the state that don't. So just being aware that this is coming allows you to be prepared financially. And again, even if you're not in Michigan, if this is happening in Michigan, there's a good chance that it could happen in your state, particularly if you're more of a left-leaning state. I mean, this is a kind of a left-leaning type of policy. And so for those of you that are in states that have Democratic governors and you have Democratic chambers of Congress, there's a good chance that this might be coming your way. I learned about this in part through a legislative tracker that the Michigan Fitness Association has, but I learned about the details of it from reading Crane's Detroit Business, which is a local business publication. So that's a great way to stay informed. Most states have legislative tracking websites. There are websites that are out there that allow you to track all the bills that are moving forward. And I'm sure those of you, particularly those of you that are affiliated with larger healthcare systems, I know that you have people that are lobbyists for your health system. And they can get you access to these legislative tracking websites, or they may have their own legislative tracking tools that they use. You guys are going to get this presentation afterwards, and anything in this presentation that is hyperlinked takes you to whatever the resource is that we're talking about. And the Health Fitness Association, which is formerly IHRSA, who's actually made some substantial changes in their capabilities since COVID, which was very much necessary. They have an email put out by Mike Kaczynski, who's their head of legislative and government affairs, every month that is a very digestible document that walks you through basically most of what's happening in the federal level that could affect our industry, but it also does provide some state updates. That is a free resource that the Health and Fitness Association provides. I'd say the biggest advocacy group in the industry beyond the Health Fitness Association is the Physical Activity Alliance. I'm a board member with the Physical Activity Alliance. We are the group that is spearheading the It's Time to Move initiative. It's Time to Move is something that I know everyone who's listening to this webinar right now would be incredibly interested in. It's Time to Move has the goal of making physical activity assessment, prescription, and referral the standard of care in medicine. And PAA is spearheading that multi-year, multi-pronged initiative. And so if you're not in the loop of what's happening with PAA, go to the website right there, paamovewithus.org, sign up for their monthly email newsletter. If you're getting the Health and Fitness Association legislative updates, you're getting the PA's monthly newsletter, you are in the loop of all of the things that are happening from both a defensive and an offensive advocacy perspective. Now, if you want to go a step further, I give you two other resources that you can go to. One is the website for the Michigan Moves Coalition. This is actually a nonprofit that I started in Michigan that is working with the Department of Health and Human Services to take the National Physical Activity Plan and pull it down to the state level and to implement physical activity initiatives in the 10 different societal sectors and then measure the impact of that implementation. And this is something that can be replicated in every single state around the country. West Virginia has a state level physical activity plan. Kansas City has a city level physical activity plan. Texas has a state level plan. We're doing one here in Michigan. I know I'm talking with some other people around the country, putting together similar coalitions in their state. But that is policy and systems change in action. So please check that out. Go to the website, see what we're doing here in Michigan. If you got questions, connect. Also, the Michigan Fitness Association, we're probably one of the only state trade associations that is still operational from the COVID period. So, please check out our website. Please see what's going on. Even if you're not in Michigan, I think these are good things to be in the know about, and you can replicate these in your state. And if you're not sure where to start, but you think it's important that you do start, please reach out to me. I would love nothing more than to provide you some guidance and some understanding of what we've experienced here in Michigan. Now, the last thing I want to tell you about is something I'm incredibly excited about. And it is going to drop next Monday electronically. And it is the ACSM's Health Fitness Journal. I was asked to be the guest editor of a journal issue on advocacy and professionalization within the exercise profession. And essentially what this issue is all about is how exercise professionals who are highly qualified become more integrated into healthcare or receive the designation of qualified healthcare professional, basically underneath the healthcare tent. I know with medical fitness, a lot of our exercise professionals do end up under that healthcare tent just because the health system has a medical fitness center. But all of you know even how complicated that is for a health system that has a medical fitness center. But there is a segment of our industry that exists outside of medical fitness that does have the necessary education and qualifications to have more interactions with healthcare. And Lord knows we need more scale than just medical fitness to address the inactivity and chronic disease crisis that's happening in our country right now. So this talks about how we get there. All the steps we need to take to go from, broadly speaking, outside of healthcare delivery to more inside of healthcare delivery, to what physical therapists and athletic trainers are for injuries, to what dietitians are for nutritional interventions. Getting an exercise professional to be part of the healthcare delivery system as a qualified healthcare professional is a massive undertaking, and we are making huge strides on it. And this issue talks about all of the various things that are happening to make that a reality. So this is meant to pretty much be a guidebook or a primer to inform the industry of what's happening and how to be involved. This is available in full for ACSM members. The ACSM has allowed for 3 articles to be open access. And my article will be open access, as well as 2 other articles. My article is the professionalization of the exercise profession. But the ACSM has also provided a discounted alliance membership for the period of time that this issue is out. So in the month of September and October, that allows people who are not ACSM members to get a discount on alliance memberships to get the full journal. I will tell you, after reading all the articles, if you are looking to be informed about what is happening in the professionalization of our industry, this is the source for you to go to. So let's talk about building relationships. And I say inside out because, as I said earlier, all politics is local, and I believe all health is local. Getting to know your chamber of commerce, your city council, your mayor or city manager, your state level congressional representative. These are people that are making decisions and doing things on a day-by-day basis that do affect you, both positively and negatively. And having a relationship is critically important. And honestly, the time to start the relationship is not when you need something from them, but when you're just trying to develop a relationship that is completely non-transactional in nature. You can connect with your member of Congress. To be clear on all of these politicians that are your city council, your mayor, your city manager, your member of Congress, state or federal, they care about you. They care about you because you're responsible for getting them reelected. And fundamentally, that's the job of a policymaker or a politician, is to keep policy making. And that's by getting reelected. So these people will talk to you. The higher you get, the more unlikely it is that you talk to the actual policymaker. You may talk to one of their staff, and don't be discouraged about this. The first time I met with a staffer for a federal congressional representative who looked like he was 2 days out of college, I was a little bit frustrated because I'm like, oh man, like what's this guy going to be able to do? How's he going to be able to help us? Well, it turns out like he was the person that would have the ear of the lawmaker, and he's the person that could provide the relaying of the information to this particular lawmaker. So he turned out to be pretty important. And since I met this individual for the first time, he's gone on now to a couple of promotions, and now he's working in another office where he's a very high up legislative aide, and now he's even more influential. So realize the low-level staffers of today become the politicians of tomorrow. So quickly, let's talk about some tips for building political relationships. I love the know, like, trust framework, and I'm sure a lot of you are familiar with this. Somebody has to know you first, then like you, and then they have to trust you for you to have a productive professional, or for that matter, personal relationship. And when I think of know, like, trust, particularly on the political level, excuse me, I think of, well, how can I provide value? Well, certainly value is your vote, right? I mean, that's probably the most valuable thing to a politician. And, I say that kind of tongue in cheek and cynically, but on another level, that is true. They do want your vote. But you can also provide them value by providing them information. In many, many cases, politicians are not an expert on anything, which probably doesn't surprise a lot of you when you think of politicians. They're experts on, on convening coalitions and bringing people together and getting reelected and raising money. They're not an expert on our industry. They don't have subject matter expertise on the things we do. Like that lawmaker that I mentioned in last thing, he didn't realize that our industry was different, that a subscription and a membership to a brick and mortar facility are 2 different things. So we provided him some information. You could also provide PR opportunities, particularly with your local level politicians. I mean, look, no one likes more than a politician who can take a picture with, a baby and some kids and maybe people exercising, right? Like that's the dream for a politician. And we can provide that to people, and we could donate money. I mean, the reality is that, money talks in politics, and I'll talk a little bit more about that in a second. But if nothing else, the building political relationships is something that you have to do a cost benefit analysis on, because certainly a public relationship with a politician, particularly the higher the politician, gets up in the food chain from state level to federal level, if there's any controversy or if they're a polarizing figure, the juice might not be worth the squeeze on that. It very well may be something that could lead to negative PR. The good news is most people like their mayors for the most part in most cities. That tends to be a less controversial figure, or that's not always the case. So you definitely have to do the calculus as to, what kind of a public facing relationship you want to have with a lawmaker. But, behind closed doors, providing information and helping them kind of do their lawmaking better, you could certainly do that. Next, let's talk about grassroots advocacy. This is, again, we're kind of, ascending in the hierarchy of involvement and complexity. Grassroots advocacy is, finding a cause that you're passionate about, maybe within the larger cause that you're passionate about. So maybe you're passionate about youth exercise. Maybe you're passionate about outdoor exercise. Maybe you're passionate about exercise for the disabled. Whatever it is, find a cause you're passionate about and organize a coalition. One thing I have realized is that, if you are the only one advocating for something, you can just be looked at as the lone nut, right? Like the one person who's over there that's talking about the thing. But as soon as you bring together a group of people that are like-minded, you start to build momentum. In many cases, politicians will at least listen to you at that point because you have enough groups and enough people that represent enough of their constituency that they're going to want to have a conversation with you, if nothing else, than to not alienate you. So here in the state of Michigan, when we developed Michigan Moves to put together this state level physical activity plan, we brought together the fitness clubs, the Physical Therapy Association, the Parks and Rec, the SHAPE Michigan, which is the physical educators, some other groups, and we approached the Department of Health and Human Services. And they paid a lot of attention to us because we represented such a large number of stakeholders. So, don't go it alone, form a coalition. And then, if you're really looking to advocate for something specific, do research to find a lawmaker who's aligned with what you want to do advocacy for, someone who would be passionate to your cause. So as an example, here in Michigan, we have a House of Representatives member who is currently a physical therapist. She actually is a practicing physical therapist. She is somebody who we look at as being aligned with our cause. It also turns out that the Speaker of the House in Michigan has his master's degree in kinesiology from Michigan State, which is a rarity. I don't know many speakers of houses anywhere in the country who have a kinesiology background. So, find the lawmakers that are aligned to you. Consider drafting legislation. Again, it's not as scary as it sounds. You find that cause, you know what you want to get done through the advocacy process. Your coalition brings that cause to the aligned lawmaker and said, hey, is this something you believe in like we do? If so, we'll draft a bill for you. We'll help you draft the bill with your leg counsel. And then from there, we'll see if we can make this a reality. So you actually are helping them out when you're doing grassroots advocacy. Offensive advocacy is a great way to influence the legislative process. And, I highly recommend you do it when you can. But if nothing else, preventing bad things from happening can be a very, very powerful way to do advocacy. So just because I'm suggesting, kind of a more active offensive process here doesn't mean we can forget about the defensive advocacy we talked about previously, because, far more often than not, preventing something bad from happening is even more important than making something good happen. So lastly, let's talk about political engagement. First thing, please vote. Please be an informed voter. Please vote on policy and substance. Don't vote on emotion. Learn about the things that are happening that do affect our world and vote in a way that aligns with your values and your policy priorities. I could care less which way that is that you vote. I just want you to be informed and take advantage of the amazing privilege we have. Apart from my soapbox on that, you can support a candidate that you believe in with your time, your talent, and your treasure. Again, this is the tip top of the advocacy pyramid. So this might not be something you're even close to wanting to do right now, but you can get there, and some people do. You could attend industry advocacy events. That's a link to the Health Fitness Association's fly-in to DC last year, where over 100 industry advocates converged in Washington, DC to do advocacy on Capitol Hill with lawmakers that represented them. And you can contribute to a political action committee. I know we hear about these PACs and these super PACs, and they sound like these crazy things that only people who have millions of dollars can contribute to. I actually contribute to the Health Fitness Association PAC. I definitely do not have millions of dollars, but I give what I can. And that money is really important. And I'll give you an example as to why it's so important. During the early part of the pandemic, it's pretty widely known that the confectioners were due to be shut down. So the people that make the candy, right, which makes sense during a public health crisis that thrived on people who had obesity and diabetes. But because of the political action committee for the confectioners, who made calls to 2 lawmakers who were supported by the confectioner PAC, those lawmakers prevented the industry from being shut down. And the reality is money talks there. And as sad as that is, particularly, given the industry that got to stay open during a public health crisis compared to ours that didn't, the money talked there. So we do need money to do the things that we're doing as an industry. So you can consider giving you a PAC. Now, I realize all of this may be a bridge too far for you. And, maybe many things I said were a bridge too far for you. But what isn't a bridge too far is being informed. It is our civic duty to be informed, and it's our professional obligation to be informed and to act when it's in the best interest of the whole. So here's my summary before we open it up to questions. All of this that we talked about today, it's a civic duty and it's a privilege that we are able to do it. And again, it is also a professional obligation to advocate for your profession and what you believe in. Never forget that if you don't have a seat at the table, you're on the menu. If you don't remember that, just think back to April of 2020. Physical activity is nonpartisan. It's not bipartisan, it's nonpartisan. Everyone agrees you should get out and you should move. Remember, there's a difference between defensive and offensive advocacy, and defensive advocacy is very, very powerful. We talked about the legislative process. It's very important to know where and how to intervene. And then lastly, we have our action steps. I know everyone has passion. At the very least, now everyone knows the sources to go to stay informed. Once you have that information, you can decide what you do with it. So that is my contact info. Marianne will undoubtedly send this out. Looks like we've got about 7 minutes for questions. So Marianne, I will turn it back over to you.
Okay, so if you have questions, go ahead and put them in the chat or the Q&A. We did have one question that came in through registration, so I'm going to start with Erin's question. She asked, value-based purchasing has hit healthcare and along with population management is unlikely to go away. Data and outcome measures are powerful tools for advocacy in this space. What programs are available in medical fitness to document outcomes outside of research?
Yeah, great question. So first off, I will say to you that I said this to Marianne when she sent the question to me. My presentation at MFA National this year is essentially on this specific topic. So I'm going to give a brief answer now, and then tease and encourage that you go to the MFA National Conference in New Orleans to hear the rest of the information. But what you said is so poignant, because at this point, what we have failed to do broadly as an industry is take the fitness outcomes that we produce for people, tie them directly to health outcomes, and then tie them to payer data or claims data. We don't have that information broadly enough right now. We don't have it in the research. We don't have the through line from fitness to health to reduced healthcare costs. We have it on some high level, but we don't have it on a granular enough level where we've been able to make that case to the policymakers. And eventually we have to. So to answer your question, I would say that as an industry, particularly medical fitness that has this as really a cornerstone of what we do, we need to be the ones who are being very diligent about producing clinically meaningful outcomes on a fitness level, being able to correlate those and tie those to people's health outcomes, and then being able to get revenue cycle information and claims data to be able to create that through line. I was talking to a member of the CDC at an event last year, and this individual said to me, you don't need to prove to us that exercise works. You need to prove to us that the people that need to do the exercise can do it for long enough to actually make a difference in their health and reduce their healthcare costs. We have failed to do that thus far. And if we are going to take the final step to really professionalize in our industry, we have to hold ourselves accountable to, and we have to be very good at managing the data and the outcomes. More at MFA National.
Awesome. This is more of a comment. Karen said that she went to the fly-in this past May in Washington, D.C. She said it was an amazing experience and she highly recommends going. Is this something that is open to anyone?
Yes. Yep. So Health Fitness Association sends out information on it every year through their social media. So follow them on social media. If you're a Health Fitness Association member, it is free. However, I mean, you have to pay to get there. If you're not a Health Fitness Association member, it is a very, very nominal fee to be able to go. But yes, it is a very powerful experience. And I will tell you, this past year, I met with Gary Peters, who is a senator from Michigan. And we met with Amy Klobuchar, who is a senator from Minnesota. So in some cases, you do meet with the lawmakers and you do have a conversation with them. So it's a very, very, very cool thing to do.
That's awesome. While we're waiting for more questions to come in, I actually have a question. You had mentioned, finding some of your lawmakers in your state, one that had a kinesiology degree, one who was a physical therapist. Where did you find that information? How did you find that?
It's Google, right? Like, I mean,
okay.
And granted, we use resources here in Michigan because we have a trade association that are a little bit different. Like we do have a lobbying firm and things like that. But look, if somebody's a politician, as we all know, everything is public about those individuals, even stuff that they don't want to be public. So you can find, that particular information. But, directly how I actually found those two things was just in my network from the coalition, that I had formed. It was, okay, somebody from the APTA, the American Physical Therapy Association of Michigan, said, hey, Julie Rogers is a practicing physical therapist and she's the head of the health policy committee. And then, Karen Pfeiffer, who's on the Michigan Moves Coalition, she said, Joe Tate was one of my students at Michigan State and he has his master's degree in kinesiology. So a lot of it is just the networking through the coalition.
That is awesome. While we're waiting for more questions to come in, I just want to say thank you, Mike, for sharing your knowledge with us today. That's tremendous. And all attendees will receive an email with a webinar evaluation. And I will include this slide deck, as Mike had mentioned in that email. The evaluation form does include a spot to indicate which CEC you would like to receive. So please be sure to complete the survey. And even if you don't need a CEC, your feedback helps us in planning educational webinars and helps our speakers with presentation skills. Not that that's needed here, however. Our next webinar is scheduled for next Wednesday, August 21st, entitled Corporate Wellness Best Practices and Current Trends with Debbie Bellinger and Lisa Simmons. And we have more webinars listed on the MFA website under the Education tab with links to the register. So you can visit medicalfitness.org. And John chimed in and said, thank you. I hope everybody leaves with this information and acts on it. I think it's fantastic. Joanne says, fantastic presentation full of helpful information. And again, it's great that there are links in this slide deck and QR codes. And so I'll be sending this out for everyone. I'll just also add that if you are looking to make a move into management, definitely check out MFA's Medical Fitness Leadership Institute and learn from some of the best in the industry, including our own Mike Stack. We're offering the Leadership Institute this year via Zoom, so you can attend right where you are. There's no travel expenses involved. So you can visit the MFA website at medicalfitness.org and look under the event tabs for more information and to register. And Mike says, really important high-level info. Thank you. Sydney says, this is wonderful information. You're a great presenter. Always love hearing you speak as I learn lots. And there was a lot in this one today. I think if anybody wants the recording link, just let me know. If you want to share it, do a lunch and learn at your facility. Definitely just let me know that you want that recording link. I'm not seeing more questions coming through, so I will thank you all for joining us today. And thank you again, Mike, for sharing your knowledge.
Great. Thank you, Marianne. Thank you, everyone else.